Hello, everyone. My name is Leanne, and today I'll be presenting to you about a public health organization called Pathways to Housing PA. So, Pathways to Housing PA is located in Philadelphia, and they are a nonprofit organization. They are a multidisciplinary team consisting of human resources, housing services, clinical services, case management, and they operate the Philadelphia Furniture Bank. They began serving the community back in 2008. So what they do, they was so this organization was founded to serve the hardest to serve people in the community. They serve and transform the lives of people experiencing mental health challenges and chronic health homelessness. Their mission, straight from their website, is empowering people with disability to improve their housing stability, achieve better health, and reclaim their lives. And some of the beliefs they have is they believe each and every individual deserve the right to a decent, safe, and affordable home without any precondition. So, unlike other traditional housing systems in which they have to agree to substance abuse treatment or other conditions, here they have no conditions. They believe every person should have the opportunity to set their own goals and reach their full potential. And they believe a home is more than just four walls. And this is a major function of theirs. So they don't just provide a house or an apartment to individuals. They help them make it a home. They make it comfortable for them. They make it cozy. This organization treats more than just the physical health and well-being. They treat the mental and emotional health of each of their clients. And part of that is by helping them make this apartment a home. Some of the core services they provide, which I've listed a few already, they provide homes to their clients. They provide primary care services. They provide mental health services, substance abuse services. They teach life skills and help participants be a part of the community. And this is huge. Many of these people haven't been in a home or a part of the community for many years. They may need help finding employment. They may need help learning how to cook, learning how to eat healthy, and just being an active member of the community. They operate the Philadelphia Furniture Bank, and they provide training and technical assistance to other communities and organizations nationwide, and specifically on their Housing First model, which pretty much means that they believe that housing is the first step and the most essential step, because once you house a person, it's easier to get them to substance abuse treatment and to seek mental health treatment and to treat their any other chronic illnesses they may have. So here this slide shows two pictures. The one on the upper right corner just shows one of their clinics and a client being treated, and then the other picture on the bottom left shows their clients and a learning to cook and eat healthier kind of like class. So that is them, getting back into the community and learning how to be independent in their new homes. Integrated healthcare program. So Pathways to Housing PA has a integrated healthcare program, and this program provides comprehensive healthcare. So many of these people have serious chronic and untreated medical issues that have been neglected for many years. They haven't received any treatment. They may have diabetes, high blood pressure, they may have a mental health disorder or a substance abuse disorder. So they need a number of services. They need to kind of play catch up and take charge of their health. So they provide primary medical care, psychiatric services, behavioral health services, and nurse care management, to name a few. Some of the services included acute care, chronic disease management, such as for diabetes, high blood pressure, coordination of hospital to home transitions, and on-site lab and preventative care. And many of these services, or all of these services, are also provided at their on-site locations at Pathways to Housing PA. That way, they don't have to worry about transportation or having to go somewhere else. These services can also be provided in their home. Many of these services can also be provided in their home at the Stephen Klein Wellness Center and at Jefferson Family Medicine Associates outpatient clinics, in which Pathways to Housing PA has a partnerships with. They have an on-site team of doctors, certified registered nurse practitioners, nurse service coordinators, and psychiatrists. So nurses do play a huge role in this program. They do a lot of case management, they coordinate a lot of services, and they do a lot of teaching and education. So who is served and eligibility? Pathways to Housing PA serves the chronically homeless people with mental illness and/or substance abuse disorders in the Philadelphia region. And over the past 2 years, they've been really focusing on the Kensington area as well. To be eligible, individuals must be chronically homeless and suffer from psychiatric disabilities and/or substance use disorders. They must agree to allow Pathways to Housing PA to visit them at their home at least twice a month. So there's no precondition, but Pathways to Housing PA does want to visit them at least twice a month to provide them the services they need, to provide them emotional support, to give them the resources, and just keep them on the right track. So how do they do it? One of the main ways they get funding and they're able to pool all of these services and provide them to the community is through partnerships. They have many partnerships now with many organizations, and many of these organizations provide their funding. They also obtain funding from grants. They obtain a good amount of funding from donations. Donations are also a very important factor. They raise money through fundraisers, and then their leadership, of course, and their staff are a vital asset. They have, collaboration and just, a good amount of the right people in their team. They have psychiatrists, behavioral health specialists, just pretty much have one person from each field, at least one person from each field. And of course, volunteers and supporters. Volunteers are also critical to their operation. So this picture here just shows what it costs to house a person per night through Pathways to Housing First PA, and it's $76 a night. And this shows in comparison to how much our system is spending when these homeless people end up in prison, when they end up in their emergency room seeking care because they've neglected their health for a long time, such as a diabetic person who doesn't have any insulin, and in psychiatric hospitals. So there you can see the difference in the impact. And this is one of the reasons why I chose to present about to Pathways to Housing PA, is because of the comprehensive services they provide to the community. They do have a integrative healthcare program. They believe that housing is the first medical intervention, and they believe that they're making a big impact on the cost and quality of in healthcare, and that's a huge thing, especially since the last few weeks we've been discussing how our environment, how different vulnerabilities and different factors can impact our health, and housing is one of them. Homelessness has a huge impact on health, and it causes our healthcare system more money to have people homeless than to house them. So success, since they started, they've had great success. In their first year, Pathways to Housing PA served 125 of the city's hardest to help citizens, and these are people that are called basically non-compliant, and people that were not able to be housed in other traditional housing systems because of the preconditions that they have. Today, they are serving 450 people with complicated behavioral health and medical issues. In 2016, they launched a program to help the chronically homeless individuals in Kensington with opioid use disorders. And currently, 150 of those people are housed, and 60% are involved in some level of substance abuse treatment. This next one is a big one. 85% of their clients remain housed 5 years later. And that is huge, especially since what I just mentioned about these people not being able to be housed in any other systems. And then 1,325 primary care appointments and 198 behavioral health visits were held in their clinic this year. Overall, 92% of their clients see a primary care physician once a year and are treating medical issues that were neglected for years. And these are issues that eventually they would have ended up seeking medical care in the emergency room, or possibly even, dying from. So future plans and needs. So Pathways to Housing PA is currently planning for the next 10 years. They will continue to form partnerships and increase their funding through new partnerships, through donations, and through grants. They will continue to disseminate the Housing First model to other communities and organizations worldwide through training. And though they are, they do have an impact on the community, they are still like over 1,000 people homeless in the community of Philadelphia. And so a lot of work still needs to be done. So they still need a lot of continued support from the community and for people to help spread awareness of the overall issue of homelessness in the community. The more awareness they are able to spread, the more donations they are able to obtain, the more support systems and partnerships they can establish. Anyone can help by volunteering at the organization or by making donations. And for the references, the second one down below, I have attached also a video from their website. And these are some of their clients just telling their stories and the impact that the organization have had in their lives. It's one thing to read the statistics and to read about what the organization does, but I feel like it has a greater impact when you hear the impact like right from these individuals' mouth when they tell their story. I listened to it and watched it, and it had a great impact on me. So for anyone interested, it is the second link. All right, thank you everyone for watching, and have a good day.